So this is a lieutenant in the NYPD who has had a chronic labrum tear right here. This is the biceps tendon. This is the superior labrum. And this tear of the labrum, which is torn because this is not connected to that, and this is torn, extends anteriorly in the front down here to Bankart lesion area. He doesn't need to have his fixed. This is subscapularis. This is a normal labrum, and that's biceps tendon. So we're going to reconstruct the biceps by taking this biceps off and reconstructing it here. Okay, Tim, let's proceed. This is a special suture that we use, that we wrap around the biceps tendon. A lot of the ability to do advancements in arthroscopic surgery are secondary to these technology advances. This special type of tape, these special instruments that have been created thanks to a variety of different companies, so that we can do our surgeries with tiny little holes arthroscopic rather than having to open the joint. And even arthroscopic, the better the technology gets, the better the results can get.
Kingfisher? Kingfisher? Need an arthroscopic grasper. Nope. Nope. Kingfisher's kind of like a flat at the end.
So I think if we just show it to you like that, in there, yep, and grab that.
Now I'll take that crab claw, please.
So he's able to take the tape, which we passed through it a few different ways. Dr. Achavan, Persian orthopedic surgeon in Pittsburgh, Pennsylvania, devised this technique. He calls it a loop and tack. Put a loop around the suture. Tries to push that tape, which is more medial, tries to kind of pull it over to the more lateral side. There we go. I'm going to go from underneath or up. I'm rotating my cable so that that instrument that my PA is using to try to pass the tape around, he can succeed in. There you go. Beautiful. Well done. Patience is definitely a virtue. That's great.
Doesn't want to slide that.
Doesn't want to slide, but it's worth it.
Around
Yep,
it?
that's worth it. Yep.
Okay.
Beautiful, gorgeous. 70-degree scope, please. Now we switch to a scope at a different angle. You can take that off.
Yeah,
Yeah, that's right. Yeah, just take that off. And as a result, you can now pass. Now my camera is at a different angle. So I can see this biceps a little differently, and I can see where I'm going to put that.
Okay.
I'm going to take this biceps and tie it down over here.
Orange, I think it's an orange.
Yep.
That orange one for the 2.5. That's a 2.9.
There we go. I'm going to put that in.
I'm out.
The patient's under general anesthesia with a nerve block. So it's a mild amount of anesthesia, which is good. Right. instrument right there, that screw, we just put right into the bone. And that's attached to that tape, which is attached to the biceps tendon.
Cutter, please.
And then we cut the tape.
Should be a flush close.
Yep. Beautiful. Switch back to a 30. Now that biceps, which is connected over here, now I cut that. And by cutting the biceps, you now have it attached on this side. Now this tear, which was causing pain before, no longer can, because the tension from the biceps that pulls on the labrum here is no longer an issue.